if medical debt can't hit your credit, but they can go and sue you at a court, and the court garnishes your wages, and they take, say, like this gentleman, $800 a month. Well, and you can't afford your car payment, your rent, your home payment. What happens if you don't pay those? And once again, it hits your credit. And there's a bigger like picture to it, and it's like, wow.
Today, I'm joined by Jeffrey Seymour, owner, CEO of My MediBill. And basically, you are in the business of helping people with negotiating medical bills, staying out of medical debt, and things like that. So I think that's a great thing, a real good thing you're doing. Can you just start off, I guess, by explaining how you got into this business and started your company, and just a general overview of the services you provide and what you're trying to really accomplish in your
Absolutely.
business?
I appreciate you having me here too, by the way.
Hmm.
I do insurance, and I actually got in a fight with a cactus in the Dominican Republic and come back and had emergency surgery, and I sold myself insurance. And I was on some crutches. They told me to go over to a little phone across the way there called the benefits department, make sure your insurance works. Well, I sold myself my own insurance. And long story short, the lady on the phone goes, yeah, you're good. And so the next day I had the emergency surgery. Well, I started getting medical bills in for almost $70,000. And I'm like, what is going on here? How is this even possible? I have insurance. The hospital takes my insurance. And a little over 2 years of fighting with the hospital over this. And come to find out, the hospital admitted that they didn't call and check my benefits with my actual insurance provider. They seen a card that had expired from 2008.
Hmm.
And I went all the way up the chain, and I said, if I have to fight this, and I got it 100% wiped away. And if I have this issue, my clients have this issue, other people have this issue, not just my clients. And so I founded My MediBill. And from painstaking phone calls to being able to help people to get it in one phone call. And there's some people who are just unable not to help just because it's too far gone, or it's just something we're just not able to help out with. But it has been a trying learning thing. We've done all kinds of stuff of helping people. For instance, we just saved a client the other day. They had about a $45,000 medical bill, and we negotiated it down to $8,500. Set up payment plans with the hospital with them, and they're setting at $100 a month is what they could afford, and they're not charging them interest or anything. So, unfortunately, those people didn't have insurance, and if you don't have insurance, things like that do happen.
Hmm. So that's interesting, actually, because I hear stories about, and I don't know how this works. You hear stories about, oh, you have insurance, you get charged this much. You don't have insurance, it's like there's a cash discount price. Do you know, like, why? What it like? I don't even know how that got started. How does that whole system work? Why do they do that?
So the insurance companies, they in the doctor's offices, if they're in network, they have a pre-negotiated network discount that they give if you have insurance and you're going to see that doctor. Outside of that, there's a cash price. People will say, oh, I don't need insurance, I could just pay that cash price, which in some instances it's great. But if you have say you slipped and fell and broke an ankle, went to the emergency room, that it's going to be $15,000. It's not a good thing for people to go without it. But the cash price is just a set thing that if people don't have the insurance, that they can pay.
Mhm.
But unfortunately, when people get in those situations, they end up in an issue where they get into bankruptcy or whatnot. And due to, actually last year, 66.5% of bankruptcies was due because of medical debt.
Mhm.
It's a big issue. There's roughly 1 out of every 3 Americans can't afford their medical debt either. Adult Americans can't afford their debt. That's 115,000 plus, or 115 million Americans in the United
So
States.
those that are going into bankruptcy, did most of them don't have insurance, and
Go
or
ahead.
or are they have insurance, and for whatever reason the bill is just super high?
That is correct. A lot of it too, it happens like whenever you go to the doctor, you go to your doctor that's in network. But whenever they do labs and they send out the labs or send you to a lab to get your blood work, it's out of network. You don't know as a person, you think your doctor's in network. Obviously, yeah. You figure your doctor is going to send you to the right place, and they don't. That's a majority. I would say a huge majority of the medical debt we fight. We're getting people's wiped away because the doctors aren't actually getting the approval, and they're just sending them there. There's bill after bill after bill that comes in with that kind of stuff. That too, surprise medical billing, the double and triple billing for the same stuff. People don't understand that happens a lot, and they just
Hmm.
pay it and go along. Well, they didn't need to pay it. And so we actually go through the medical bills for our clients and make sure they're not
So,
overpaying.
so you'll get like an itemized bill
Hmm.
go through. Now, how do you know how much stuff is supposed to cost? Like if you're getting an itemized bill, like they're saying you got charged this much for an aspirin, or you got charged this much, like you're going down to that level.
We're going down to that level now per hospital, all that stuff. We don't know exactly what all the prices are.
Hmm.
I don't think anybody knows. I don't even think the hospital knows. I think they just write it down. But we go through the bill and make sure there's not like if someone's been in the hospital, use this as an example. It's not something that happened, but say you went to the hospital and you were in the emergency room and somehow they charge you for 8 ibuprofen, 800 milligram ibuprofen, but you remember only taking one. We catch that kind of stuff. We
Hmm.
look for that kind of stuff. We also look for making sure you're not double paying the bills, because there's one hospital in general in Missouri. The clients had actually paid 3 of the exact same bills, but they don't tell them that. They didn't tell them. They just kept taking their money, which is the wildest thing I've ever seen. And we got their money refunded back to
It's
them.
like a hospital from the
Yeah, the
hospital.
billing
Yeah,
department at the
yeah,
hospital. It's like, I don't know how you guys do that, but they do. And I'm like, oh my goodness.
yeah. And I know another confusing thing is like you do go to the hospital, and like you were saying, you get bill after bill, and you'll get one from the hospital that provided the service. You'll get one from a lab company. You'll get one from a doctor that was consulted that is there at the hospital but has their own practice or something. And so you'll get like these multiple bills, which you don't know that when you're going in.
No.
I mean, I guess it's an emergency situation. So what are you supposed to do about it?
It's crazy. Like, so the other day I had a client out of Maryland call me up, and the dentist, we spoke with the insurance company about the medical bill he has. He's like, I don't understand why I'm paying this. My preventative is supposed to be free, and I paid $158 for the preventative. He goes, that doesn't make any sense. So we called the insurance company first, made sure his insurance was still good and everything, even though I can see it in the system. But we called the doctor's office or the dentist office and spoke with the head billing manager. And she told me and my client, which is their client, well, it's your job to know exactly what you got to pay for before you have the surgery, or not the surgery, but the services done. And I asked her, I said, how did he know what you're going to do when you're in there working? And you said you had to go and take like an x-ray, like I forget the exact verbiage for, like on one tooth, not the whole mouth. How did he know exactly what he's going to have to pay for that? She goes, well, that's not our fault. It says he has to pay us no matter what. And he goes, well, I already paid you $158. She goes, yeah. And then we got end up getting the insurance company back on the phone. The insurance company said, hey, here's the deal. If you just recode that and send it to us, we'll cover it. What you guys did was kind of wrong, and they end up taking care of it. And it got covered as preventative. Just it's the way that they coded it was just wrong. And the insurance company's like, we can't take it that way. It's a partial exam versus a full exam. So it's just those little things that we've got to get into and find out with the clients.
Hmm.
They'll send us their summary of benefits, their bills, all that kind of stuff. And so we know exactly what their deductible is, what their max out of pocket is, what their co-insurance is, and find out exactly how much they've already paid in towards those deductibles and max out of pockets. Because once they've hit those, then if they're paying anything over than that, that's wrong. That's the surprise billing that they
Hmm.
should never be getting.
So for the most part, are you finding that, I mean, I guess it's been in the news a lot lately with insurance companies, just the whole pre-authorization thing and like denying, services, and there's people that need stuff done and they deny it and they delay things. And is that what you find from like, because you're in this world, like what do you see?
I typically don't see the denying. The one thing I do see a lot of denying is for like Ozempic for diabetic stuff.
Hmm.
And these companies, because some of this stuff's so expensive that the insurance companies are like, no, we're going to do a step therapy. And so they'll start the clients out at a low, like generic until no, those don't work. Then slip them to a brand, then non-preferred brand, then to the
Hmm.
specialty. That's a little bit of an issue. That's a hard one. But outside of that,
Thank you for joining me on the podcast. Don't forget to subscribe and let me know in the comments who you'd like to see me have on the show next. Because the stories I guess I see in the news are like, hey, the doctor wanted to do this, but they couldn't, the insurance company denied it, or they couldn't get authorization
right.
to do whatever they wanted to do. And it's not like you know the whole story. You don't know the whole
Right.
story, but it's just like, man, if you got a physician who's like really trying to do the right thing, it just seems awful that someone at an insurance company, because I mean, they employ physicians as
Right.
well, but that they can just kind of make that decision when there's a primary care or specialist, whoever is like, no, they need this done.
Right. And that's a good point. What we do for our clients as well for MediBill is they can pick up the phone and call us, and we will actually call the doctor's office, find them a doctor, and call the doctor's office and help them make sure they're at an approved facility for their insurance. That for that very reason, right there.
Mhm.
For instance, for me, May 13th of last year, 2024, I had brain surgery. Kind of a weird thing. We were diving in Spain. I thought I ruptured my eardrum. Went to see one ENT, and then seen another ENT. They thought I had a brain tumor. Come to find out when they did the craniotomy and went in, my skull ruptured. My brain went down to my inner ear canal. It's kind of a
Wow.
crazy story, but what I'm trying to say is on that part, right before my surgery, the insurance company I have, they made sure they had the pre-authorization in my hands before that surgery was even done.
Mhm.
Now they're getting to those points now, especially if you're on the marketplace. But if you're with plans outside the marketplace, there's all kinds of holes and gaps on it.
Mhm.
A lot they don't cover pre-existing, so you might think you have insurance and you go to a hospital that's for what is called short-term medical, um, and you might go to a hospital that's actually in network, but they don't cover it because they tie it back to something that's pre-existing. That's where we go in to negotiate. We
Mhm.
negotiate. We have some clients that I have one. He has a son that has cancer, and we negotiated a little over $1 million down to 250,000.
Hmm.
So that's where our negotiation part comes into effect. As of right now, we've saved clients over the last 2 years since I opened the company up in September 2023. We've saved over $14.2 million for clients.
Wow.
And it's a small amount. Sounds really big, but if you look, there's what $220 billion worth of medical debt.
Mhm.
That's just a scratch of the surface. And we've tried to market. That's a crazy thing. We've tried to market, and there's no way to market. No one out there is doing what we do with the MediBill. You can go and hire a lawyer. It'll cost you about $3,000 to $10,000 up front.
Mhm.
Well, if you're having issues paying your medical bills, how can you pay a lawyer up front?
Mhm.
One of my buddies, his stepdaughter, she is kind of stepdaughter. His girlfriends. They've been together forever, but she paid a lawyer. She had $12,000 in medical debt. Paid a lawyer $5,000, and he got it knocked down to $8,000.
Didn't
Like
come out.
it cost you an
Yeah.
extra $1,000 to go talk to the lawyer.
Mhm.
And what we do is we just do it simply. It's for a single person, it's $20 a month. A couple is $30 a month, and a family of three or more is $40 a month.
Mhm.
And it takes normally about we say on average 4 to 6 months for us to really negotiate, because you got to get all your bills in.
Mhm.
Once we start the process and doing everything, we file the bill claims or file the claims for the clients as well. It's a process, and sometimes we get it done on the first call, which is the best.
Mhm.
But then we've got active cases right now. We're still fighting,
Mhm.
and it's a tough situation for people when they're financially hurting already. I opened the company up not to make money. I did it just because I knew it was a need for clients that need this service, and it's turned into something bigger than what I even thought it would be.
So you were selling insurance, health insurance prior to doing this.
That is correct.
I mean, you were hearing stories, or the first time was when you were
No, I
hospitalized?
heard the stories. I just didn't know really until it hit me.
Yeah.
And then I realized, oh my goodness, this hospital was in network. How do I have this bill? And we fought and fought and fought. And I mean, I went up to the vice president of the company, and the one that was the head of the billing department told me, well, even though we made a mistake, you still have to pay that bill. And I said, if I had to get a lawyer, I will. And unfortunately, my lawyer does work for the hospital, so he can help me out there. So then that's really when I was like, I've got to figure this out. And that's when I stepped my game up with them, and I started researching, looking all the different aspects of all this stuff. And finally, when I got to the top of the chain there, the vice president of
Mhm.
the hospital, we got it completely write off is what they did.
Mhm.
He goes, well, this will never happen again. I said, well, I hope I never have to have a surgery like that again. But
Yeah.
it's sad though that people get this and it happens to them. I have a client out of Missouri. They they had some big bills. She went in the hospital for 2 months,
Mhm.
and because of this, I helped them out. And their insurance, and unfortunately, she went to the wrong hospital. They took her to the wrong hospital, which in the emergency
For her
rooms,
insurance.
yeah, the
Yeah.
emergency has to take you as if
Yeah.
you have insurance or you don't, or if you're in network or out of network, until you're stable.
Mhm.
And she sat in this hospital for almost a month, not knowing. And long story short, they end up getting out of there and transfer.
Mm-hmm.
But that was a big one.
Mm-hmm.
We definitely had to fight over that one, and they almost lost their home.
Hmm.
And she sat there and cried and cried and cried over the phone. I'm like, well, I can't guarantee we can get something done, but we're going to do our best.
Mm-hmm.
And we got it knocked down. It was a little over $200,000, and we got it knocked down to about $48,000.
Hmm.
So
I've only dealt with it on a small scale. I'm trying when my wife was pregnant. We were out of town, and I think she had some stomach pains or something, and so we had to go to you find the nearest hospital that can take care of that kind of thing, and
right,
you go there, and of course the insurance is, if you're in town, if I was here locally, we would have gone to the facility that took our insurance, but when you go to the nearest one,
right,
and to get them to pay for that coverage, which they said was, out of network. I'm like, well, I was on vacation. I wasn't even in the state. It was, it took a while to
right,
resolve. We had to get letters from the physician that said, yes, in that situation, I would have sent her to the emergency room. And, it took a while to resolve. And I mean, it wasn't anything near. I mean, it
right.
was, I don't know, 100 or maybe a couple thousand. I don't know. It wasn't that much, but I can just imagine when you're dealing with hundreds of thousands of dollars.
And it's crazy because right now with the marketplace insurance, the maximum out of pockets have went up to 10,600 now per person, up to two people per family.
When
That's
you say the marketplace, are you talking about like
Obamacare.
Yeah,
Yeah,
Obamacare,
yeah.
yeah.
And so what's happened too is, the American Rescue Plan Act that was enacted during COVID, they dumped in $1.9 trillion or whatever it was. And then in August of 2023, they extended it to the end of 2025. They dumped another $360 million billion dollars into it. And it expires at the end of this year. Well, people think all these subsidies, the government's taking the subsidies away. They're just, all the extras from COVID are just going away, which we don't have a problem with COVID anymore.
Mhm.
Well, now the premiums are skyrocketing 200, 800%. And people are going, oh my gosh, what am I going to do? You got the max out of pockets that are going up to 10,600 with plans. And people, they're not going to be able to afford that. If you can't afford $400 a month, how are you going to afford a $10,600 max out of pocket?
Mhm.
That's where we can also go into negotiate with and say,
Mhm.
hey, maybe not necessarily negotiate, but help the clients out with the payment plans we set them up on.
Mhm.
We had one client, they could only spend $20. They literally had $20 a month,
Mhm.
and that was it that they could find in their budget to pay. And the hospital we took us a little while. They wanted $200. And I was
Mhm.
like, no, they just don't have it. And it went back and forth, back and forth, back and forth, and finally got it down to $20. But the other problem is too, is in, I think it's around April 2023, the Biden administration said that, medical debt won't hurt your credit, or it can't hit your credit. And that was a real thing too. Only up to bills for $500 or less. Anything over $501 or more could still hit your credit. The hospitals had to take you in the emergency room, just like before, but doctors can turn you away. If you're not paying your bills to the doctor's office that are under $500, they don't have to take you because it's not an emergency. You're just going to see them, especially if it's their own practice.
Mhm.
Well, back in January, they made it to where no medical debt could hit your credit. And I just heard something. I've tried to follow up on it a lot, obviously. I just heard something that's possibly being reverted and taken away again. But here's the thing: if people think our medical debt can't hit our credit, think again. Because I have a client, before I even started the medical debt stuff, he got sued by a hospital, 18,000 some change. And he called me up. He's like, "What did I do?" I'm like, I have no clue. And long story short, because he had short term medical, it didn't cover. He had a hernia that I did not know about, and he had to have surgery because of that hernia, and they didn't cover it. So the hospital ended up suing him. He got a lawyer, and his lawyer talked to the hospital's lawyer, and they said, "Here's the deal: we'll go ahead and settle outside of court for $16,500." And he goes, "I don't have that." And the lawyer goes, "I guess we'll have to go to court." They didn't just go to court. This just happened back in the summertime. This is from 3 years ago, and it finally, the whole thing hit back in the end of June, early part of July. The hospital now has garnished his wages. One in court garnished his wages for over $817 a month until he's paid back.
So that's a court order?
Court
Like it just
order.
automatically comes out.
Yep. They garnished his wages. And he goes, "I don't know what I'm going to do." He goes, "I'm going to have to go get a second job." I'm like, unfortunately, there was absolutely nothing I could do. It was already in the court system and all
Mhm.
that. So looking, doing a deeper dive into this, if medical debt can't hit your credit, but they can go and sue you at a court, and the court garnishes your wages, and they take, say, like this gentleman, $800 a month. Well, and you can't afford your car payment, your rent, your home payment. What happens if you don't pay those? And once again, it hits your credit. And there's a bigger like picture to it, and it's like, wow, it's really.
Have you heard of that more than that one
Yeah.
instance?
Oh yeah, it's happened. Especially since they did this back in January, it's happened to at least 4 clients that I know of through other, not my personal clients, but other people I know, other agents as clients. And it's wild.
So they don't send them to like collections?
They do send them to collections.
What is like when a hospital, when you're not paying your bill, what is that? How does that whole thing work? Like
So they'll send you the bill, and sometimes the hospital, depending on the hospital, sometimes they'll send it within 30 days. Sometimes it's 120, might be a year. Just depends on whatever hospital and whoever's in the billing department, I guess. But they will actually send it to the collections. The collections right now cannot hit your credit, but if they don't get a hold of it, they'll keep selling it off until somebody wants to take it to court.
So at that point, you don't actually owe the hospital. You owe whatever company they sold it to?
It's a weird thing because negotiating the other day, we had a guy that has a medical bill in the collections hands. And the hospital, they said, well, you just call the hospital and figure it out, because he's like, we're still fighting with the insurance to cover this. So we called the hospital. Hospital said, well, you got to call them to pay them. They said, you got to call the hospital to pay them. And he's sitting there going, what do we do? And finally he said, what we can do, because you're waiting on insurance to cover this. They said they'll cover it. They just have to have an extra note from the doctor. I said, pay your medical, pay the debt that's sitting in the debt collector. Mm-hmm. The insurance is they've already told you they're going to reimburse you while we were on the phone together. They just have to have this letter. I said, that way this doesn't go any worse. That's the last thing we want doing is going to court and getting sued. And that just takes time, stress, all that kind of stuff.
So when they go to collections, that could get sold multiple times. Yep. And then eventually these collections, they're companies that just are buying people's debt that they owe, and they try to recoup it.
And they'll buy it. Say, I'm going to make this up here. Say you have a $10,000 bill at the hospital, and the hospital says we're done dealing with it. They'll sell it off to a debt company for $7,500.
So the company will pay the hospital $7,500.
And then it's now that company's time to whatever they can get. If they can get the full $10,000, that's money in their pocket. That's how a lot of these companies work like this. And it's I think it's a scam. I really do. I don't think it should happen. If your debt cannot hit your credit, or so your medical debt cannot hit your credit, then why are you sending it off to a bill collector? It's a way to get people's money, which understand services are done. You need to pay for what you got, but if you ain't got the money, then how do you do it? And that's where we go into, once again, negotiating and trying to find government assistance programs if need to be. There's all kinds of different things we do for the clients to help them out like that.
What are your thoughts on Obamacare or the marketplace? Because you were an agent, prior to, opening this business. So what are your observations? Because you hear good, you hear bad. What do you notice about it?
I actually think Obamacare is great. I just think it needs to be reformed and it needs to be revamped and add some better stuff to it. I think the premiums are out of control. I think the insurance companies are getting rich from the government with all these subsidies that they're giving them. COVID really was kind of like an eye opener with all this extra money. They had ghost-written policies out there for people that didn't even know that they actually had a plan. And they kind of fixed it last year. Going into last year, they made us have consent forms and stuff to get from the clients. But if you knew my name, my date of birth, and the state I lived in, you could steal me or you could write a policy and I would have no clue. That's how the system worked. And that was happening. I like the Obamacare. I like the fact that it covers pre-existing. I can't have any other insurance other than the marketplace unless I have group insurance. I'm self-employed. I don't have group insurance. So I sell myself marketplace insurance because I had brain surgery and I've still got 2 more surgeries to go. So I will never, ever be able to get off this kind of insurance. I'm just hoping that they don't, and I don't think it'll get canceled out, but they just revamp it and give it some better ties, maybe lower these max out of pockets. But I don't know too much on the insurance side of stuff. Like there's a company called Aetna, completely backed out of the marketplace for this entire United States under 65. I have clients on Aetna. Now I'm having to find these clients new policies for their doctors. I have one that's got a specialist that has to see, and it's in no network now. And it's like, what do we do? Now I'm going to have to be negotiating the prices with her for
Mhm.
this kind of stuff.
So you can, I was talking to you earlier about pre-negotiating prices and things before people even go in for more. I guess it would be more like elective stuff.
Yeah.
Like if you have a surgery or something you need done and you have insurance or you don't have insurance, things can be pre-negotiated before you go in.
That is correct. That way they know exactly what they're going to be spending.
Mhm.
And we try to get it knocked down as best as we can. On average, we're saving about 20 to 60%. Every case is unique in its own situation. But some of them we've got knocked down 100%. But when it goes to pre-negotiating those prices, we're seeing about a 20 to 40% discount is what they're willing to give.
So who's taking the loss on, like who's losing on? Is the facility, like the hospital, or the doctors not getting paid as much, or how does?
I don't know on that one. That's a good question. I don't know how that is and how that works.
Mm,
But if you're going in for a procedure, say you needed I don't know, just say you wanted to get a facelift,
mhm,
there's going to be a price for that. Insurance isn't going to cover that. Well, you're either going to pay it out of pocket or let us help negotiate it and at least see if we can save you a couple of grand on it.
mhm,
It's just I don't know. I don't know what the actual price of a like what it would cost a doctor to do an ankle surgery. I don't know that
yeah,
kind of stuff. And I don't know if we negotiate it, if he loses money, or if it's the hospital, or if it's his nurses, or if it's
yeah.
the anesthesiologist. I have no clue on that.
Mhm. So what do you think is an ideal? It seems like there's a lack of like no one no one knows what the prices are. Like how would you set it up if you were in charge and they said, we want you to be set up, a system that's transparent. What would that look like?
How I tell all of my clients is if I had a system like that, every hospital, every doctor would accept any kind of insurance. It didn't matter. There should be no network restrictions. It should be you accept or you're a doctor, you should have to accept insurance. And to the doctor, I don't understand why they wouldn't. But I know there's rules and with the insurance companies say, hey, you're going to be in our network. You can't be with this, whatever. But I think it would be that. I think the prices should be age banded. So if I'm 43, then I'm paying a flat price. How old are you?
40.
40. So
Yeah.
you're 40, you would be paying a little less than me.
Mhm.
Because you're younger. I think it should be just an age banded thing, like some life insurance policies and products out there, stuff like that.
Mhm.
That's how I see it. If there's any way that the government could come in and just say, "Hey, we're going to fix this. We're going to rehaul this. Everything's going to be covered pre-existing. Get rid of this." But the insurance companies, it can make them go bankrupt. And I think that's what happened with that now. I don't know too much on their stuff either, but when you've got a whole company leaving the United States and says we're only going to do Medicare now, we're not going to do under 65. There's an issue.
Mhm.
And it's a big issue because there's now, once again, people that are going to be having bills because they have specialists that aren't going to be in networks now.
Mhm. Do you work with Medicare?
Yes.
What are your observations about that?
Medicare is a funny thing. I'm my cousin, my business partner. He owns the company, our insurance company, and he's more the Medicare kind of guy. He talked me into doing Medicare, get my AHIP and my license, do all the Medicare and stuff, because I was losing clients that were aging off of under 65.
Mhm.
When it comes into Medicare, I don't know as much as I should about it, but you got the whole alphabet with it. So you got A, B, C, all the different things with them. Man, it's a whole complicated system.
I just always thought it was weird that you get to this retirement age and you've been paying in, and then even then there's options where you have to pay more.
Yeah,
I always
that's
thought it was just kind of unfair.
I
Like,
can use my mom as go ahead.
like there's just, oh, you retired now and you paid into this, but you can pay a little bit more and get better coverage. I don't like, just give everyone good coverage. I don't.
So with Medicare, you have Part A, you're entitled to Part B. Everybody, you can have Part A is free.
Mhm.
Part B, you're at the $185 a month for the Part B. You can have that taken out of your Social Security, railroad account, whatever it is, or you pay it yourself. The part, the extra stuff, Part G and all that, those get pretty expensive. And there's like restrictions on it, like with the first 6 months that you get your Medicare.
Mhm.
You can get your Part G, you're going to pay for it, but it's not underwritten. Anything after that, it gets underwritten. So it's wild. There's a lot of stuff there to be unfolded that That's why I try not to dive too much into it. I have it, I do it. It's not my forte. If I have questions, I call my cousin.
Hmm.
And he's like, yeah, no, that you're right. You're doing this.
Yeah.
And the tape, the red tape that goes with it. You're calling, you got to call. And if you're talking to someone on the phone, you have to send them a scope of appointment. You have to have a permission to contact. It has to be recorded. Same thing with under 65 through the marketplace. We have the consent forms that we have. We have 2 consent forms now that you have to get, and we have to keep them on record for 10 years.
For you to work with someone.
Mhm.
Yeah.
That's the silly part. It's like, okay, that's a little excessive. If you've already got it and they've signed it, it's time stamped, by their IP address, the date, time. If it's sent to their phone and they do it through their text, it stamps all that. There shouldn't be a reason why we should have to keep those for 10 years.
Hmm.
But it's keeping us safe and keeping our clients safe. That way, make sure no one's stealing them or
Hmm.
switching policies out on them that they didn't know.
Hmm. What's some of the biggest things that your clients just don't, I guess, comes as a shock to them, that they just don't know, that probably the average person just doesn't know, that if they knew, they could maybe help themselves out a little bit, besides just knowing that, like, you need you need insurance. um I guess, is there anything they can do to help navigate it, them, like, if they have to go to the hospital, is there anything that they can do to not to help navigate while they're there?
Um, when it comes down to the billing side of things, not really. I mean, I tell my clients, hey, even on the insurance side, doing insurance, I'm like, if you need to go to the hospital, don't call me at 10 o'clock at night. There's nothing I can do. Just you guys get your stuff done, and then we can worry about the bills later on. But kind of the same thing with that, what you're just asking. It's like, not really much you can do while you're in the hospital
Hmm.
besides get whatever's, the problem is, get it taken care of. After that is when you've really got to start. If you
Hmm.
don't watch it, you just let a bill slip and then it hits collections and you didn't realize it.
Hmm.
That's where you got to start to kind of do your due diligence and making sure you're watching for those letters in the mail.
Hmm. um Back to court the court cases. So, and you said you've seen several of those. Is that, like, is it increasing? Is it getting more and more frequent? Is it something that they're getting more aggressive about, or?
Yeah, because they're losing money.
Mhm.
And I mean, I don't know, like, once again, I don't know what these doctors make, but they got to pay these doctors big money to be in their facilities. And if they're losing money, then the doctors are getting mad or whatnot, and they, end up wanting to go work somewhere else or whatever. But it's happening quite a bit. You're starting to see it, especially since the rule back in January where no medical bills could hit your credit. People are just not paying them. Well, that's also driving the cost of everything up as
Mhm.
well. And yeah, it's expensive.
Mhm.
It's really expensive. And I just don't understand how the hospitals can charge so much though for stuff that's like when they did the surgery on my head, they used a diamond tip whirlybird drill bit, and that drill bit alone was $16,900 some odd dollars. What the heck? But it's those bills that come in that you start seeing going, oh my goodness, we have to go through those bills to make sure, kind of on the backside, they're not being
Mhm.
double billed for stuff, and that their true max out of pocket and their deductibles are only being paid and nothing more, not a penny more.
Mhm. Yeah. Maybe you know about this. Like, when someone goes for a surgery or a procedure, and, you know, did they have a set, like the DRGs, the diagnostic is it diagnostic related groups? So they'll get charged whatever $20,000 for this procedure, and if the hospital can do it for cheaper than that, then they basically keep the
The
difference.
rest of it,
Yeah.
yep.
So if they're opening multiple packages, like, for instance, if they open a sterile package and it falls on the ground, they got to go grab another one and open up a
They're
new
being charged for
sterile
that.
package. So is the patient, do the patients get charged for that kind of thing? Or is that like, because I know there is a difference between, like, some hospitals are privatized, some are public. Some, like, you would go into, I remember, like, back in nursing school, you'd go into the supply closet, and, like, you had to scan the stuff you were taking. Like, this is going to this patient. And I don't know if that was inventory or for charges.
Yeah.
But I just wonder, when mistake, like, if a mistake like that happens, is the patient seeing, like, eating that cost, or is that coming out of the the profits of
That's a
the
great
hospital?
question because I don't have like all the notes from like the surgeries and stuff. So I don't know what was used or whatnot. If there was two, I don't know, forceps used
Because I know
or
they keep track, like especially with not maybe so much with like the instruments, but like when they start getting to like expensive catheters
right.
and things that they're putting inside, they'll take a sticker off and put in, they keep track of all of the stuff. And I just wonder like, well, what if they drop one? They got to get another one. Does the patient get charged
I've
twice? Or
always wondered that because years ago I used to be a firefighter for about 7.5 years, and the ambulance would come to the firehouse and we'd be on a call, and there was just stuff everywhere. You're on calls, you're going doing all
Mhm.
your kind of stuff, but then I had friends that would grab the IV bags and use them later on and just tap themselves with it to get hydrated. I'm like, what are you doing? He's like, I don't know. It just comes right off the ambulance. And I always thought about who gets charged for that. Is it the person, the patient, or is
Mhm.
it the actual ambulance district?
Mhm.
And I have no clue on that one. And it's got to come. Somebody's getting charged for it,
Yeah.
and I'm wondering if they're sneaking it in on the bills.
Yeah.
But I have no way to because I'm not there when they're doing the surgery. There's no way for me to know
Yeah.
exactly what they're doing.
Because like you said, that one instrument they used on you was what, $16,000?
$16,000, like $900,
Yeah.
and diamond tip whirlybird drill bit.
And I've seen, um, times at the hospital where they, for whatever reason, they have to use, like, I don't know, maybe the first one just doesn't work, and it's not it was not even a big expense, but whatever device they're using, um, it's they can't get it to work or something, so they just grab another one and use that, and where does that? I would assume the hospital would eat that cost. I guess I don't know, but
Right.
maybe it goes on the bill.
And I also don't know. You work with, like the hospitals kind of stuff, so I don't know if they take the stuff kind of like the nail salons. If you've ever been in like a nail salon, get your nails like a
Hmm.
manicure or anything, they'll open the packages up, but they've also got like a little laser thing that they put the sterilizer,
Hmm.
and they put the stuff back in the clean packages again. So I don't know if they're reusing the stuff either.
I mean, most of the stuff in like procedural, um, that I see gets thrown away.
Does it? Okay.
Yeah. Now I know they do have like autoclaves and stuff that they clean some stuff with,
Right.
but I'm not exactly sure what they put in there.
Yeah. And so that's makes me really think too. Is like I need to start really figuring out exactly what the cost of all this stuff is.
Hmm.
Just for the fact of, I mean, if they're charging one hospital's charging $800 for a scalpel on that beard, or on the bill, and another hospital's only charging 300. Well, why are they so much?
Hmm.
Is it a different kind of scalpel, or is it the exact same scalpel as someone got used over here? But, there's so much just to dive into
Hmm.
that we're constantly learning every day with the MediBill, trying to find new ways to help people out. And like this very conversation right here is very enlightening, just for new stuff that just someone else hasn't said anything to me before about, and I'm like, oh, okay.
Have you noticed the difference between privatized hospitals and public hospitals?
Not really. The thing,
Like county run, taxpayer funded, like local, you consider a local hospital versus like the big corporations that have are privately owned, have multiple facilities.
no, I haven't really seen much with that. The ones that are like the big ones, there's one up in St. Louis, John Barnes Jewish.
Hmm.
That's a hard one to find, like doctors in network within these insurance carriers. That would be about the only thing I would say. The difference is too. Also, you have those concierge doctors
Hmm.
that have their practices, and there's nothing they'll work with on those. Those
Yeah,
doctors are
yeah.
unworkable. I have a client that pays $25,000 a year just to see this one person 2 times in person and 4 times over the phone.
Hmm.
And I'm like, why are you doing that? And then they also have marketplace insurance.
Hmm.
I'm like, well, why are you doing this?
I will tell you, I see them at the hospital.
Yeah.
They're they know everything about their patients.
Yeah.
The ones that I mean, they it's like they don't even have to go look at their chart. They know everything about
Well,
them.
that's good then.
And the ones that I've seen anyways, they I mean, because I know they're the patients they see, they have their cell phone number. I mean, I'm sure each of them have different plans.
Right.
Some of them, you see them only a couple times a year, and maybe there's a tiered system. Like if you pay this much, you
It
get.
might be too.
But the ones I've seen, they got their cell phone numbers. They'll call them. Like if I can't get something fast enough, they're like,
Right.
"Well, I'm going to call the doctor on the phone then." I'm like,
Okay,
go
okay.
ahead,
Perfect.
go
That'll
ahead,
help us out.
call him and he can put the orders in the computer.
Right.
um, but they're really good. And I mean, I guess that's what they pay for is the immediate, because you go into a hospital and you may not see your doctor
Right.
till five
The
o'clock.
doctor will be in around 10 and it's like
Yeah,
3 o'clock in the afternoon. They're finally
yeah,
swinging by or something.
yeah. Not the concierge. The concierge
Right.
doctors. I mean, they're there. They'll come. They'll make house calls. Um, yeah. So, but yeah, they charge for it. That's for
That they
sure.
do.
But I think they only have like because they're charging, they might only have like 100 patients or something like that
Right.
instead of thousands.
I know there's one in Sarasota that a lady I know went to, and it was about 10 grand.
Hmm.
And there wasn't much with it, but
Hmm.
they wanted to do all kinds of tests and all kinds of stuff like that. And she ended up backing out and getting her money back.
Hmm.
But it, I just, if it's great, if you have the money for it, go for it. If they're that good, if I had that kind of money, I would then if they're on top of it.
If I had the money, well, I mean, there's it's just like anything. I'm sure there's good ones and I'm sure
Right.
there's bad ones. I'm sure there's some that are, the first qualification is you have to be a good doctor.
Right.
So, yeah, there's probably good and bad with it, but I've seen a lot of just immediate attention that you don't. It's not like the other doctors don't care. It's just that they have so many patients
Right.
that they can only spend 5 minutes with them,
Yeah.
and you know that's another thing that I've seen change in the hospital and healthcare system is that physicians just don't have the time to spend with their patients
Yep.
because the next one is they got 5 minutes and they got to move on to the next
Yep.
one.
I know my ENT, the doctor that did mine. Did my surgery at the Tampa General, and he's a great doctor. But like you're saying, he was in even when I've been in his doctor's office, is boom, his assistants are in there, and then he comes in. All right, if you need anything, let me know. And this is right before the surgery one. I'll see you in 2 weeks for the surgery. All right, gotta go. Have a great day. It's like, okay, that's simple and easy. But it is crazy getting people in for doctor appointments. We help with that. And man, I'll tell you what, some of these doctors are booked out 6, 8 months out in advance now.
Hmm.
And that's you heard about it with Medicare, but even under 65, it's you're having to book that far out in advance is wild.
Hmm.
So I've been having to tell clients, I'm like, if you don't mind finding a new doctor, we can get you into a new doctor. It's not a problem. My mom, she just moved to Florida. We moved her back from Israel, and so I was putting her back on Medicare down here. And I found her a doctor conveniently. She was the very first patient they had. It was a brand new doctor. It was one of the first ones on the list of providers. And they're like, "Yeah, you're our first client. Perfect. You get the right place, right time." She called on I want to say on Friday. It was in there on a Wednesday.
Hmm.
So there's a lot more doctors that are coming into the networks, so it helps out. But people are sometimes too stubborn to go to a new doctor. You got the medical information, bureau that all your medical records are in anyway, so that doctor's going to be able to see your notes
Hmm.
for the most part. Uh, if you need to see a doctor, find one.
Hmm.
But people wait. I don't know why, but
Do you work with telehealth at all? Because that's
uh,
like a new thing where, like, even like I think Amazon has it now, where
oh,
you
do
can,
they really?
yeah, you can go on your phone and like I don't know exactly how it works, but there's an option somewhere on Amazon where you can like I don't know if you have to like get established with someone through telehealth, but there's an option on there somewhere.
Huh, I'm gonna have to search that tonight. Whenever
So I don't know. Do you see anything with telehealth and?
So telehealth is great. In marketplace has it. Outside the marketplace, you can put it on plans if that's an extra thing if they want, whatnot. But I think they're great. I'll be honest with you because if you're on vacation, say like in Yosemite or something, and you have no clue where a doctor's at, and you think you got pink eye, you can just jump on the thing. Hey, I think I got pink eye. Show them a video,
Mhm.
and they're like, "Oh yeah, you got pink eye. We'll send your medication to this pharmacy. Da da
Mhm.
da. What's the closest thing to you?" And you find out where the CVS or whatever's close to
Mhm.
you. You have your prescription sent there. I love the fact that Teledox does that.
Mhm. Yeah. There's a lot of another new thing popping up all over places. These standalone emergency rooms and urgent care centers. I've been to urgent care centers that are within network, and they're usually like not busy.
Right.
What I've know, the ones I've been to is like they're not busy and it's not quite an emergency, but you can usually get in and get out, and
Right.
there's doctors, nurse practitioners, and everything there that can get you what get you what you need, and a lot of times it's quicker than even going to your doctor's office
Right.
because you got to call them, and if you can't explain it well over the phone, they want you to come in, and it might not be that day, but
And that's what I also tell clients too, on the kind of, it's not just about saving on, the medical, it's also education, what we do. And trying to get the people, the public to understand you don't have to go to the emergency room because you get the coughs and sniffles.
hmm,
It costs you so much money to go there. Go to urgent care. You know, there's those minute clinics, those, that kind of stuff. It's way less expensive.
there's a minimum that they're going to do when you walk in the ER.
Mhm.
Like, well, as soon as you walk, I know, like with my insurance, as soon as you walk in, it's like you have a minimum. Like you're paying whatever the couple $100 just to walk in.
Oh, so some of these plans with the marketplace, some are $250 copay, some are $2,500 copays, and people don't realize that. And as soon as they get those bills, they're screaming, going, "Well, what do I do?"
Hmm.
We help you make a payment plan
Hmm.
because the hospital's going to say, "Well, you came here. That was your copay to the insurance company
Hmm.
that we negotiated, and that's what you're going to pay."
Because I mean, depending on what you go into the emergency room for, it's like chest pain or abdominal pain, or you having trouble. You say I'm having trouble breathing. It's like, okay, well they're gonna draw blood.
Yep.
You're gonna see an ER physician. You're gonna go get a CAT scan or an MRI, EKG.
Yep.
There's just like all this stuff they're gonna run you through, and then after 8 or 12 hours of being there, it's a lot of times it's you're fine.
Yep.
You're fine. You can go. It was just whatever, uh, and but then the bills come.
Yeah. Those bills come in, they're high too. I'll tell you, the fact that people go there for the cost of sniffles, I understand if you're really hurting. The public needs to know what we try to like educate our clients about is the complexities of the healthcare system, to help them know, hey, you need to be, like I just said, instead of going to emergency room, go to urgent care. You have questions, pick up the phone and call, because we're here to help. We're not here
Mhm.
just to negotiate a medical bill. We're here to help do all kinds of stuff for them.
Mhm. And just a little bit more about your company. You are nationwide,
Nationwide.
so you're located in Florida, but you're familiar with all of the. Is it pretty much the same nationwide?
Yeah, it's exact
It's
same. It's just
insurance.
different in different hospitals, different doctors'
Hmm.
offices. We do it every state, Hawaii, Alaska.
Hmm.
It's all over. The only thing we don't do is Puerto Rico. Don't do anything with them.
Hmm.
But other than that, yeah, anybody that has any medical debt, it's not insurance. It's simply it's just we're basically consultants,
Hmm.
if you will, that way. Um, we just work the best we can.
Hmm.
I don't know. It's just one of those things. Like I said, everything's a unique situation with every single person,
Hmm.
and so it's constantly a learning curve for us.
Hmm.
But we getting the job done though.
Hmm. Have you had any clients travel overseas and have to have something emergently done in another country?
Me. It happened
You.
to me. That's how I ended up
Yeah.
started this, because I got in a fight with a cactus in the Dominican Republic.
Yeah.
But other than that, no. It's only
Okay.
been here in the States.
I am curious about, um, like socialized medicine, and it's, it's one of those things I don't know anything about, and I know like what I hear is you have socialized medicine, but the taxes are higher.
Right.
That's like the big, I guess, headline is that, you're paying for it in one way or another, but then I also hear that you go to the hospital and basically you don't get a bill.
Right.
Um, so I don't know um, what the full pros and cons are of it either way. If it ends up being way more, I mean, what you hear is it's way more expensive in the end,
Right.
and you get subpar care.
Right.
That's what I hear.
Honestly, I don't know much about that.
Mhm.
I don't. Um, that's one thing we haven't really dove into on that, like learning that and understanding that part.
Mhm.
But like another thing we're looking at trying to do is we're trying to figure out a way to help negotiate animal bills for the vets.
Mhm.
That's one thing we've been trying to figure out too. That's a whole nother realm that it's taken some time to figure this one out.
Um, you had mentioned that you do like dental negotiations too. Why is like medical and dental and vision? It's like you have like medical, dental, vision. They've always been like this separate thing. Why don't they just bring them together? Like, because I just noticed that most people, like me too, but people I talk to, is like the dental can just like kill people sometimes,
Right.
you know? And it's like not like medical, but it can be thousands of dollars. Um, and it doesn't seem to be like the dental insurance doesn't seem to provide as much coverage.
Right. And it doesn't. I tell clients all the time, there's no such thing as good dental outside of group.
Yeah.
And finding a good policy, I'm not going to use the company's name, but there's one policy. There's no waiting periods. There's no or it has copays for all your preventatives free. Basic, you have a copay for basic, tier 1 major and tier 2 major, but there's no max cap on the benefits. Meaning, as long as you're going to that dentist that's in network, then they cover 100% after that copay. All the other plans, that's the only one like I've seen it out there. All of them max might be $3,000, $5,000 of coverage.
Yeah, I think that like I had to get a root canal one time, and it was like you get your $1,000, and then anything after that is like coming out of pocket.
Yeah, and then also too, it depending on the agent that sells them the insurance. Well, I'm not talking bad about agents, but it's a quick sell. Let me in and out. What's the cheapest way to get a sell from them?
Mhm.
And they don't do their due diligence. And they have as a health insurance agent broker, you have a fiduciary responsibility for your clients, and you got to watch out for what their interests are and their money and all that kind of stuff.
Mhm.
And some of these agents, they just sell just to sell and make money and be gone. And if they cancel, I've got 100 people signed up.
Mhm.
And they're not actually looking at the right policies. You need to find out from these clients. For like the dental thing, like you're talking about. Do you need any work done? Do we need to find out what exact kind of plan you need to be on, just versus finding the cheapest one and giving it to them that only cover like $1,000.
Mhm.
So if agents would do a better job at that, go in more detail with the clients and figure out exactly what it is that they need, we wouldn't have issues. I wouldn't say wouldn't have issues. We wouldn't have as many issues
Mhm.
with the billing on that side.
So how is dental insurance different from medical and I mean like there seems to be like limited less coverage. Is it because healthcare is more of a necessity, or is there's not as much money for the insurance companies in it, or um, you know what I'm trying to say? Like it just seems like there's less options,
For
less
for dental,
coverage for dental. Yeah.
I've wondered that for years. I don't know. I don't know why there's not. I don't know if it's just because dentists can come up with their own prices on how much they think a tooth is going to cost to change
Mhm.
out. It's not maybe not a set through the industry. I don't know on that. I think it's wild that there's no. You were actually asked a question earlier if there was like a way you could kind of revamp insurance or whatever. That'd be one thing I would do is put dental in it. The marketplace has plans that have vision and dental. Not that great. You might
Mhm.
have $400 worth of coverage, or
Mhm.
$1,000 worth of coverage, and that's it. And it's just there's nothing out there really that's good. And
Is it because there's another thought I just had is does is the like the government less involved in dental? Because it
outside the marketplace, no, they really don't have their hands in the dental at all. It's just private companies,
Mhm.
like a Aetna or an Allstate or Aflac or
Mhm.
whatever companies, Delta Dental, whatever has their policies. So that's this they're private companies that
Mhm.
sell them out.
Yeah, maybe that's why. Because when the government gets involved, they can kind of dictate things a little bit more when they're subsidizing
Right,
stuff.
exactly.
Yeah.
Which that's another thing too is when people are buying this marketplace insurance. Kind of one of the things on the medical side of things, if agents would know and understand, you got to help your clients out. These max out of pockets and deductibles are outrageous. You need to be protecting your clients by adding on little ancillary products like an accident medical expense or critical illness for the event of like cancer, heart attack, stroke, blindness, renal failure, appendix, kidneys, HIV, AIDS, that kind of stuff that helps pay for those deductibles, and then max out of pockets. Or say you slip and fell and broke an ankle, it's an accident rider in there to cover that amount of whatever the deductible max out of pocket is.
Mhm.
And if they would just do that, then we'd have a lot less medical debt in the country because face it, The main causes why people hit their deductibles max out of pockets are accidents and critical illnesses.
Mhm.
It's not because you're going to the doctor every single month getting labs drawn, all that kind of stuff. It's the stuff that we don't expect to happen that
Mhm.
happens. And if the agents would actually help out and educate their clients, so find out what their budget is. And this is really how I would treat my clients is if it was my brother, my mom, my dad, my sister, whoever it be, um, I try to find out what their budget is
Mhm.
and try to stay as far under that budget as possible, but by giving them the best bells and whistles possible with that insurance. That
Mhm.
way there's no holes, no gaps, or at least minimize the gaps. But if people did that more, there wouldn't be as much medical debt
Mhm.
because the
So,
main.
so what's the minimum that you would get like emergency services? 'And that's going to cover like catastrophic, like if you fall off a ladder or something, you have to
Right.
go to the emergency room and get surgery. Is that like if someone's just like I just can't afford anything? I mean the just the basic emergency services is
It's expensive.
what is it?
Yeah, I would say on average, I would say probably around $4,000 to $8,000 anytime you step into an emergency room.
Hmm.
If you broke an ankle or something. Now, if you just went in there to get stitches or whatnot, I don't think it's that much. But for kind of a little bit of a major, like a broken bone, broken leg, whatever, I'm gonna say venture somewhere between $4,000 to $8,000 is about average. Every time, automatically, you're gonna get that kind of bill.
With insurance.
Yeah,
Yeah.
yeah, and it's outrageous, and especially if your deductible is $8,500, the insurance company's not covering a penny of that until it's paid.
Hmm.
And so, I mean, even if it's $4,000 that you got to pay, that's a lot of money. I mean,
Hmm.
most people live paycheck to paycheck, and it's unfortunate that people don't have that kind of money. And that's where once again we step in to help them out with that.
Hmm. Yeah, I don't know what the answer is with these insurance companies because they make so much money, which like I'm all about people making like you should be able to make whatever money you can make.
Yep.
But then I'm just like, man, they make so much money and people are going into like medical, debt over even like with insurance and
Right.
stuff. And it's like, well, what's the end? You don't want, I kind of like I don't want the government to like start getting over controlling, and
Right.
they do have to make a profit.
Yep.
But it's like, where's that balance at?
There's got to
You
be a
know?
balance
Yeah.
somewhere, and I don't know. I really don't know where I could start on that. Just if I had an idea, it would just be like, hey, there's going to be a cap. This is as much as you can charge because I mean these premiums. I have clients out of Tampa. They're looking at over $3,500 a month for the couple. They're conveniently they're a doctor
Hmm.
and they have the money, but they're like we don't want to pay it. Like no one wants to pay $3,500. That's a lot. That's almost $40,000 a year.
Hmm.
That's a lot, or a little over 40, ain't it? Yeah, something like that.
Yeah.
And it's insane. There's got to be caps on this. But you're right though. The insurance companies they've got to make money. They're in business. They're not a charity, so
Hmm.
they're there to make money. But there's got to be a cap somewhere on this stuff. The premiums can't keep going up. I don't
Hmm.
know who's going to be able to afford them. At the marketplace, you get your subsidies, and there's the FPL, the federal poverty level, that's based off of household income, all that kind of stuff. And if you're a single mom with three children, the children are getting kicked over to Medicaid, but you still have to pay $500, $400 a month for insurance. You've got an $8,200 deductible, a $10,100 max out of pocket. How can you afford that if you
Hmm.
have to use it? And so it's a very complex system that no one, it's not that no one wants to dive in and tackle it. I think they're just putting it off
Hmm.
and they've got bigger fish to fry
Hmm.
in this country. And I'm like, no, the healthcare system definitely needs revamped.
I've always wondered, and this has come up a couple times on the podcast, why doesn't the insurance companies have more of a push to like incentivize people to be healthier? Because like just when I'm thinking through it, it's like if they're still if people still are going to have insurance, so they're going to pay for insurance,
Right.
wouldn't it make sense for the insurance companies to give their clients incentives to stay healthy, and in the long run the insurance company would still be collecting those monthly payments, but maybe their clients wouldn't like end up in the hospital with
Right.
these like, long like heart failure
Right.
and obesity and these just longer term things. I just feel like they don't wouldn't they make more money in the end doing that?
You would think so. I do know, like the current carrier I have for my insurance, they actually have a program that you follow, like go in there and do a 3-minute read on something in their system. They give you reward points, then you can cash those in for gift cards or
Hmm.
I don't know, different things you can buy through their system. If you're eating healthy, they want to send you stuff like that. That all kind of like in the lines you're saying, but I don't think it's to where it should be.
Hmm.
But I think you're right. I really do think you're right on that. If they actually did something to says, hey, you know what? Here, do this. We're going to send you this. We're going to make sure you are getting your screenings every year. You're going to do this, and this, and help the clients out that way. I think you're right. I think they would save a lot more money to have their clients, and clients wouldn't be jumping back and forth through different carriers.
Yeah, I don't understand it, but I'm sure I'm not the first person to think of it, and I'm sure that they've if they're not doing it for a reason.
Right.
And so I just it doesn't make like I don't know. I mean, they must have gone through and figured out financially it didn't benefit them.
Right.
Otherwise, if it did, they would be doing it.
The- yeah, because they're a
And
mean, they're a well-oiled machine, and
mhm.
they know obviously what best works for them. But I think you're right. Yeah.
Or maybe they're just not thinking 25 years ahead. Like, hey, if we do this now, in 25 years, this person that we have that's paying their monthly deductible in 25 years, we can probably over that 25 years keep them out of the hospital, 3 times with a heart failure
Right.
diagnosis or kidney disease or whatever. I don't know. Maybe they don't think that far ahead or uh,
I don't know even if they really care. I think they like their money coming in like it is already. They know that person leaves our company. We got another one's going to come in.
mhm,
Medicare every single day. They have what 12,500 people aging into Medicare every single day. So they know they get that coming in. Medicare is a whole complex system, but they have stuff they do like a health risk assessment after you set up a policy for them. They do have like extras incentives in their policies. They have like a buy down or a give back program in some of the policies, which helps pay to buy down their Part B. So
mhm,
instead of paying $185, they're actually only going to pay $40 after what, just depending on whatever the policy is.
mhm,
And they give you over the counter, like a card, like credit card, debit card for over the counter. Might be $150 a quarter, or it might be $40 a quarter. You got to use it or lose it. And so those are extras that they do, but I don't know on the Medicare if that's forced by the government or if that's the actual insurance company going, hey, we want to do something kind for you guys.
mhm. Um, so just a couple more questions. What in your opinion is the healthcare system doing well? Um, what needs improvement? Which it's some of this we already talked about.
Right.
And then how do you fix it? What's the how do you get to the point of improving it?
Improving it wise, man, they're gonna have to, whoever the lawmakers are with this Obamacare, however that's been established through, and when Obama was come out with it, they need to sit down, and both sides of the parties, how I see it, how it look like is quit fighting each other and actually have the well-being of the citizens of the United States at hand versus your guys' pockets. Find out what, poll people, ask people what they would like to see, what they want, how their insurance is working for them, what's not really working for them, why aren't they using their insurance this way. And if they, my personal opinion is, if they poll the citizens and find out exactly what our wants and needs are and build something tailor fit that around to what the majority
Mhm,
of the population is saying we want, I think that would be a great start.
mhm. What do you think's being done well? What do you think we
Oh,
do the best at?
I would say, man, there's a lot of good things about it. The pre pre-existing coverage, I think that's
Hmm.
probably the best thing.
Yeah.
The worst thing about that is the high prices of the Obamacare,
Hmm.
the marketplace. That's the kind of the which one
Yeah.
you got to have this, but I think that's the best part of it,
I
personally.
think some of it does get stuck in politics,
Mhm.
and sometimes the citizens get kind of forgotten about.
Yep.
I mean, I have no idea. I don't have the figures, but I'm sure that the insurance companies are giving money and making donations, and
Right.
there's always just that thought of, you give donations and you don't do it for free, you expect something in return.
Yeah, I just had this conversation
And
with a client the other day about that very thing. They're like, how are these companies getting so much money? There was they come out with a total. It's like 184,000 or something like that. Ghost written policies through the marketplace. It means you have a policy written on you and you have no clue you had a policy. So the government's 100 because it's a $0 premium. So the government's giving, say the policy's $2,100 a month. The government's sending that money straight over to the insurance company. They're making out like a bandit. You have no clue that you had insurance, even though you have group insurance through your employer, because someone just put a ghost written up policy on you.
mm-hmm.
And they found 100, so like I said, around 184,000, if I'm correct, of those. Now that in my head, I think that's where the insurance companies are kind of like getting paid off to maybe give them, I don't know, super PACs or whatever,
Yeah.
donations to their campaigns and stuff. So I don't know.
There's a lot of money being made, and it seems like there could be better care or better coverage,
Yes.
at least,
Yep.
for the amount of money that's going into it.
And I get the high deductibles. I really do get the high deductibles because the marketplace is for actually people that need insurance, that are sick, or they just don't have the money to pay for insurance outside the marketplace, or they don't have group insurance. I get that. It's just so expensive for clients and just citizens in general that it's just, there's some people that get it for free still, even after all these extra subsidies are going away. Their premiums aren't going up, but maybe $1 or $3. My policy this next year, I think, is going up like $40. Okay, that doesn't hurt my feelings, but it's the ones that are going up. One client, they're the ones here in Tampa, from a little over $2,000 to $3,500. That's a big increase. That's $1,500 a month. That's a lot of money. I don't see why you should be charging that much for an insurance policy. Your deductibles are already high. I understand you got to make money, but you're just robbing Peter to pay Paul at that point in time.
Yeah. Well, this is all great information. I think I learned quite a bit, and thanks for coming on. Can you just let everyone know your company, how to get a hold, because you are nationwide.
Yep.
So your company, how to get a hold of you, your website, any social media that you're on, or things like that.
Absolutely. Our company is My MediBill. I'm Jeffrey Seymour. I'm the owner, founder. Matt Binkowski is the vice president of our company. You can reach out to us, go on the web at myMediBill.net. On there, you can either sign up, you can email us info@mymedibill.net, or there's our 800 number on there as well. You can give us a shout out.
Okay, great. Yeah, I encourage everyone to do that, because I know you, like you said, you've saved people a ton of money.
We are, and this is a new thing that we're stepping into. We're helping companies out. One last thing before we jump off here, we're helping companies out as a benefit for their employees, because what happens is people are stressed. They miss 2 to 3 times more work days than a person that's not stressed out. You're not focused on work. So we're implementing this with companies now to add it as a benefit for their company to have.
So they get as a part of their benefit package, like they get their paid time off, they get this, and then they get your services too.
Yeah.
Oh, that's a good idea. Yeah.
And so I think that's a route that I think is going to work best now, because we did the marketing thing, and we just could not find the right channel. People don't want to pay for something unless they need to have they have a bill that come in the mail. When you spend a lot of money on marketing, you're like, well, that didn't work. So we're always kind of revamping and find out different ways. That's another reason why we're trying to figure out this whole dog vet, like the vet bills, if it's even a possibility for us to negotiate those. So I appreciate you having me here.
Yeah. Thanks for coming on.
Absolutely.